Good morning, everyone. Welcome to the Singapore Business Group webinar. The topic today is certainly timely. It's about COVID-19 and how to keep you and your family safe. My name is Chung. I'm a Vice President of the Singapore Group, as well as a partner of Baker Vietnam. And of course, I'm really delighted that today we have Dr. Jonathan Halevy from Family Medical Practice join us. But before we start, I'll quickly mention as well the co-hosts, which include the BBGV, CTCVN, Hong Kong Business Association, the Indian Chamber of Commerce, the Malaysian Business Association, and the Thai Business Association. Of course, I'd also like to thank our sponsors, Capital Land, UOB, BSIT, KPMG, Minor Hotels, the Hammer Hotel, and the Fumi 3 Specialized Industrial Park. Okay, so the agenda, you should see it on your screen. We're going to have quick introductions. The session itself would then go on for about 45 minutes. And then towards the last 10 to 15 minutes, we will have time for Q&A. So the Singapore Business Group was established in 1992 and it started 30 individuals and now has 350. Certainly we're business focused, but as you can see, our mission includes promoting social and cultural, and in this particular case, health-related activities. In fact, what I think COVID-19 has shown is that certainly great economic impact, but also great social impact, and the two are incredibly intertwined. Next slide, please. So these are some of the Singapore Business Group membership benefits, so you can read at your own leisure later. Okay, so we're going to do a very quick introduction of Jonathan, who's the Chief of Pediatrics at the Family Medical Practice. Next slide. Well, Jonathan, is very well known and very well regarded. My two kids as well. So he first joined Family Medical Practice in 2005, then returned in 2013 following a brief stint in Melbourne. He's also authored a Vietnamese language book, Insurance Health. Next slide, please. Okay, so I think we're going to start with the discussion proper. So Jonathan, I'm going to hand it to you, and so that you can tell us more about COVID-19 and how to protect yourself. As you all know, there's a lot of information and misinformation and speculation that you can find online. So we're really delighted that Jonathan can help us get more perspective, maybe set the record straight, and of course to share his own thoughts about what's going to happen now and maybe the crystal ball, what might happen in the future. Okay, so Jonathan, over to you.
Thank you so much, Mr. Chung. Good morning, everybody. I'm Jonathan. I'm going to talk to you today about the COVID-19. I'm sure that most of you already know this information. It's out there on the internet, on media, and there's no way you can miss it. Just a background about this virus. Coronavirus is a large virus with a genetic material called RNA. There are several types of coronavirus that are very common in humans, and they usually cause common cold, respiratory tract infections, mild viral pneumonias. But from time to time, we have coronaviruses that jump from animals, especially from bats, through intermediate animals. And they are new to our bodies and to our immune system, and they can cause severe respiratory infections, such as the SARS and the MERS, if you remember. And the current COVID-19 is a similar virus from the same family. As you know, it originated in a wet market in Wuhan, probably passed through an intermediate exotic animal from bats. And it causes, in many people, actually, the virus doesn't cause any symptoms. And this is one of the biggest problems dealing with this virus, because it can spread quietly for a long period of time before it becomes detected. People who get sick, most of people who develop symptoms develop mild symptoms. It can be high fever, cough, it can be dry or productive cough, sore throat, body aches, muscle pain. Some may develop diarrhea. Especially in children, diarrhea can be a significant marker of the coronavirus infection. The virus can pass through droplets through the air with cough and secretions. It can pass through surfaces. There were studies that showed that the virus can stay viable on certain surfaces up to 72 hours. On steel and plastic, for example, it can stay up to 72 hours. Yesterday or the day before, there were reports from the coronavirus ship that they detected virus material even 17 days after the patients were evacuated. But it only indicates that they managed to find material from the virus. It doesn't mean that the virus was actually viable. Basically, it's equivalent to finding a body a few days after the murder happened. The incubation period can last up to 14 days, though there were a few cases that the incubation period was a little bit longer. But the average is about 4 to 5 days. That means, on average, it takes 5 days before symptoms start to happen. And during these 5 days or this incubation period, people can be infected. And again, most people who have the virus don't have any symptoms. For me as a pediatrician, luckily, children are in a very, very low risk group. It doesn't mean they don't get infected, but it means that their chances to develop a severe infection is very, very low. Children can develop mild cold, mild bronchiolitis, but usually not more than that. In China, there was one child at about 14 years old that died of severe pneumonia, but the death rate of this age group is very, very low. As you can see, as the age progresses, the death rate progresses for several reasons. One is because elderly people have lower immunity. Elderly people suffer from more chronic conditions like respiratory conditions, cardiac conditions, hypertension, and diabetes that put them in higher risk of death from complications such as pneumonia. People with immune deficiency, either genetic immune deficiency or acquired, for example, people who are under treatment for cancer or high dose of steroids for long periods of time, their immune system is not functioning well and they are in a higher risk to develop infection. Some studies from China show that smokers are in higher risk to develop pneumonia, up to 14 times higher risk to develop pneumonia than people who were not smoking. How to protect ourselves? This is a very important question. And as you know, here in Vietnam, most people already do it for 3 months already since this thing started. One of the most important thing is what we call social distancing, and we'll talk about it soon. You need to limit your stay outside as much as possible. You need to keep away from people. If you go outside, use a mask. It's optional. In Vietnam, it's required, but the World Health Organization recommends it only if you are sick or if you're a healthcare worker and you might be exposed to the virus. Wash your hands frequently with soap and water for at least 20 seconds. Use alcohol gels to sanitize your hands frequently. You can use alcohol solutions or bleach solutions to disinfect surfaces. If you need to cough and sneeze, use a single-use tissue and discard it immediately. And very important, avoid touching your mouth, nose, eyes, and face, because this is the way viruses penetrate our body. With social distancing or quarantine, why it is very important. First, if we take, for example, the influenza virus, on average, one person who has influenza can infect 1.4 other people. With coronavirus, one person who is sick can infect 3 people, and those 3 people infect 3 more people, and etc., etc. That means that it grows up in multiplications of 3, which causes an exponential increase in the number of cases that we see. And this is basically the same picture that you see all over the world. In the beginning, you have small numbers of patients, and gradually it starts to increase, and then it reaches a point where it starts to rise exponentially. If you look at the numbers all over the world, basically, and it's also in Vietnam, basically the numbers double every 5 to 7 days. That means if a week ago there were 1,000 patients, today we'll have 2,000 patients. Next week, it might go up to 4,000. And this is exactly the problem with this virus, because this virus spreads very quietly. Most of the people who have the symptom, who have the virus, are asymptomatic at first, and they keep on spreading the virus. And governments try to quarantine and try to check for the virus, but the problem is we are always 2 steps behind the virus. And that's why in many countries we see this surge of patients. The cases that are identified now were actually infected last week. The big problem with the coronavirus is the rapidity that it happens. So if we take, for example, again, influenza, many people compare influenza to the corona. The influenza virus kills about 650,000 people each year around the world. And we never had to do such measures for the influenza. The problem is the influenza, it causes a lot of death, but the rate that the patient arrive to the healthcare systems are very gradual. With the corona, you can have the same number of patients that come at the same time, and that overwhelms the healthcare system. So you have, instead of having 100 patients coming every day for a month, you have 1,000 people coming at once. So, and your capabilities are limited. That's why in Italy, in China, in Spain, what happens is many times they just don't have the ability to treat very sick people. And these sick people who could have been saved, unfortunately, pass away. This is why it's very important to keep social distancing, to try and reduce the speed that the virus spreads around in the society, and try to reach a condition where the healthcare system can cope with the number of patients. The winning combination, the way I see it, and the way it worked in Singapore, South Korea, and at a certain point in China, is you need a combination of several things. You need a very strong and a very reliable government. You need a government that the people trust and follow their instructions. You need social discipline, like you see here in Vietnam, like you see in Singapore, like you see in Korea. You need to have a good system that can test as many people as possible and as fast as possible, like they do in Korea, for example. They test close to, I think, 30,000 people a day. And this way you can you can test even asymptomatic people. You can catch the infected people faster before they infect other people, and you quarantine them. And this gives you the ability to limit the quarantine measures in your country and as much as possible, reduce the damage to the economy that this virus causes. One of the big problems that people usually don't think about, I mean, everybody's saying stay home, stay home, stay home, stay safe. But the problem is, besides the fact that you can't go to work and you can't earn your money and you're living, there's a big issue of emotional and psychological toll that this quarantine takes on the children. And you need to remember, here in Vietnam, children are being locked up at home for the last 3 months. We don't have school since the Tet holidays, and many parents, because of fear, they just lock the kids up at home and they don't let them go out. Over time, I get more and more reports about children who suffer from depression, from sleeping problems, because their whole daily routine is shattered. They go to sleep whenever they want, they wake up whenever they want, and they don't have any physical activities whatsoever inside the house, so they develop sleeping problems. There are friends of mine who work in psychological companies. They tell me about teenagers who complain about feeling isolated, feeling depressed, and even communicating online at some point is not enough to help alleviate these symptoms, because at some point these kids say that they don't have anything to talk to their friends because they're at home, they don't do anything, they don't have any shared experiences they can talk to with their friends. They become frustrated and they start isolating themselves. They no longer talk to their friends. They no longer participate in online school activities. And that can lead to a lot of tension at home, between the kids and the parents, between the parents themselves. And this is a big problem that we need to address. What can we do to help our children cope with this situation? It's very unnatural situation. So there are several things we can do to help them. First of all, it's very important, set the routines. Children and even adults, they cope better when they have a routine, when they know when it's time to wake up, when it's time to eat, when it's time to exercise, when it's time to go to sleep. It's very important to keep these routines. It will help also with sleeping issues. When the child goes to sleep at the same time and has the same routine to fall asleep and wakes up at the same time, it will reduce the risk of developing sleeping disorders. Try to get virtual play dates with your kids' friends as much as possible. Try to encourage them to connect with their friends, to keep in touch, to keep talking, participate in online studying at school. You need to understand that this situation is very hard on everybody, so try to be flexible with children's behavior because they can't always control their frustration. Take it as an opportunity to spend more time with their child. I know that a lot of working parents always complain that they don't have enough time with their kids, so this is the best time for you to spend more time with your children, talk to them about what they like and dislike, about their hobbies, about the toys that they like. You can play with them, you can sing with them, you can exercise with them, you can do yoga with them together. Once in a while, take a break. I know it's very important to stay home and stay safe, but it's very important also to take a break from time to time. You can go out for short, limited time. You can go out to open areas like a park, like a swimming pool, if not a lot of people around, or even to a secluded beach or playgrounds when people are not around. That's okay. You need this break and your child needs this break. As long as you keep the rules of social distancing, I mean, keeps away from crowded places, stay at least 2 meters away from other people, try not to touch public surfaces like handles and rails. And again, wash your hands frequently and don't touch your face. It's okay to allow your child to meet a friend once in a while if this child doesn't have any risk factors like traveling history or being in an epicenter area. and if the child doesn't have any respiratory symptoms. So from time to time, it can be okay to let them meet each other for a while. And ask for professional help. Again, this is a unnatural condition. We as human beings, we don't isolate ourselves. We are very friendly animals, so we need companionship. And people develop anxiety, panic, stress in this condition, depression. Our psychiatrist, Dr. Miguel, is running online consultations with many patients, and it is very effective. It's very helpful. And again, remember, nobody is perfect. So you can lose your temper from time to time. You can show your frustration from time to time. That's okay, as long as you do it in a respectful way and as long as you don't hurt anyone. I'm sure a lot of you have questions about the coronavirus and about other issues, so I'll be very, very happy to answer your questions to the best of my abilities. We already had a few questions that I can go through with you. One of them is, what are the activities should an individual allow to do outside during the pandemic? So basically, we talked a little bit about that. You can go out from time to time again to places, open places, places that are not crowded, um, and stay away, keep the social distancing rules. Is there any sign of community spread in Vietnam so far? So most of the cases so far has been from travelers that brought the virus here with them. But I'm sure that we are going to expect to see more and more in country or in community spread in Vietnam. And again, like the rest of the world, the number of cases in Vietnam has doubled over the past week. I have numbers here. So a week ago, for example, there were 76 cases, and yesterday there were already 141 cases reported. So unfortunately, yes, I think we should expect to see these numbers continuing to rise. Number three, how long do you think this pandemic will last? Only God knows. I really hope and pray that by the end of April we'll start seeing significant improvement, but there's actually no way to know when this virus is going to be behind us. Number four, if I come back from overseas and being asked to quarantine at home, how do I interact with my kid? That's a very important question, because you need to treat yourself as if you have the virus. Because again, the incubation period can be up to 2 weeks. That means you can have the virus and have no symptoms for 2 weeks. So if you are quarantined, you need to act as if you already have the virus. That means isolate yourself in one of the rooms at home. Keep this room properly ventilated. Use a mask. Wash your hands frequently. Try to avoid touching shared surfaces. If you can, use a separate bathroom. And if you need to hand over objects to family members, they can either use tissues or single-use gloves and discard them afterwards. Number five, how do you predict the pandemic situation in Vietnam? Again, this we probably will see more and more cases, and there's no way to tell when this thing is going to be behind us. Thank you, everyone, and let me know if you have other questions.
Thanks, Jonathan. I mean, that's very helpful. I think it adds a lot of perspectives. For folks that wish to ask questions, I'm sure you can see on your screen there's a chat, so you can put your questions there. I get the sense that connection might be a little bit patchy, but if folks feel very strongly that they wish to speak up and ask a question, then yeah, please do so. All you have to do is I would ask, of course, that not everybody unmutes at the same time, because we're going to have this for me. Okay, but I would like to lead off and ask a few questions myself. Actually, there's tons of questions, so I'm just gonna jump right in. Okay, I think right now there's a lot of anxiety about if and when I should see a doctor. You know, I know there's situations where you feel that, oh, I wish I can get tested. Can I get tested now? I don't have time. How can I do it? And then at the same time, you also have people that maybe suspect or maybe a little bit but they say, no, no, I don't want to test. I don't want to test. So it's quite interesting to see very different views around whether or not it's going to be tested or not. So I guess maybe you can speak to that. But if I can just add one more related question, which is that, for example, a bit of a running nose, a bit of a body ache. I understand that those may or may not be the key symptoms of COVID-19. Okay, and when I go to see a doctor, if I go to family medical practice, and what's the experience going to be like? Am I going there and all of a sudden I'm bundled off into the hospital? Am I asked to wait outside? Can I come in? So I think even folks with ill from more normal situations, uh, or if you can talk a bit around that.
I'm sorry, the connection was not so good, so I think I heard most of the questions, so I will try to answer them. One about the tests. Ideally, if it was possible, we would test everybody at the same time. This way, we could detect everyone who is infected and isolate them, which would be very helpful. This is what the Koreans are trying to do. Unfortunately, there are not enough kits to test. So these kits are reserved to highly suspicious cases or cases that is important to identify the virus and contain the spreading. Many times, what they do here is just if there is any suspicion, for example, traveling or being in the epicenter, the authorities will just quarantine you without testing you. And if you develop symptoms, then they will test you and to see if you have the coronavirus. If you feel sick and you want to go to our clinic, it's very important that you will call in advance and talk to one of our doctors and get an advice if you should come to the clinic or not. And if you need to come to the clinic, they need to be prepared to isolate you or to be to protect you and the environment from spreading the virus. So if, for example, you're sick and you have high risk that you've been infected with the coronavirus, it might be a better idea to go straight to the tropical disease hospital or Chorai hospital to be tested there than go to the clinic. In our clinic, in both our clinics in Taodin and in District 1, we have a special tent that and a special nurse that is fully protected, and she or he cleans everyone that comes to the clinic. We check temperature, we evaluate the risk factors, traveling history, being in epicenter, known epicenter, and if there is any doubt, a doctor would check the patient and then decide if this patient needs to be quarantined or needs to have the corona test done. Okay, I have a question from Miss Catherine. From the parents' point of view, we are very worried for the kids. Even the death rate of children is the lowest. There are many cases of infection recently which affect their body organs functions later after recovering. How can I protect my kids from the COVID-19 safely? And at the same time, they will not have the trapping feeling at home. Okay, that's a very important question. So first, again, luckily, most of the children either don't have any symptoms or they have very mild disease, even those who have confirmed COVID-19. So in this point, we are really lucky that children are spared. You protect your kids the same way you protect yourself. That means social distancing, washing hands properly, teach them not to touch public surfaces and not to touch their faces, their eyes, mouth, and nose. It's not easy with kids, but as much as possible. And again, we talked about the things you can do to help your kids deal with this isolation feeling. And again, if you have a problem or you think your child have a problem, you can always contact our psychiatrist, Dr. Miguel, for professional help. I have another question. May I ask what happens to people that recover from coronavirus? Any dangerous impact on their lungs or respiratory system? It depends on several factors. First, it depends on your previous health conditions. So, if you've been a very healthy person, if you didn't have any chronic lung disease or chronic heart disease, if you're not a smoker, your chances of recovery are very good. Your chances of full recovery are excellent. Small percentage of people, especially those who had severe pneumonia or developed severe complications, and people who had chronic health problems to begin with, they might be left with some injury to their lungs that will reduce their lung capacity for a period of time. Most of the people probably over time will recover from that as well. But again, it depends on many factors. One of the things that actually I wrote about it today on my Facebook, on my medical Facebook blog, is the connection between vitamin D deficiency and respiratory infections. Um, we know that a lot of people and a lot of children suffer from vitamin D deficiency, and it's very surprising. A few years ago, there was a big study that was done in China, and it showed that close to more than 60% of children suffered from vitamin D deficiency, and close to 90% of adolescents had low levels of vitamin D in their blood. In the US, there was a similar study that showed similar results, and it showed that 22% of those who had vitamin D deficiency had extremely low vitamin D levels in their body. We know that vitamin D is very important, not only for healthy bones, but also for our immune system function. And several reviews show that giving vitamin D supplements routinely, either daily or weekly, can reduce the risk of contracting respiratory tract infections by up to 20%. This effect was even more pronounced in children who suffered from low vitamin D levels to begin with. Currently, there are no studies that check what happens with vitamin D supplement and coronavirus, but I think it's very reasonable to believe that giving vitamin D supplements to your kids might help reduce the risk of developing respiratory infection from this virus. Another question is, what about masks? Do we wear or not wear masks? If wear masks, are there any specific types of masks that are recommended? That's a very good question. Here, the government recommends everybody to wear masks. The problem with the masks are that the regular surgical masks, for example, this mask that I'm holding here, doesn't really protect you from getting the virus. The surgical mask is basically to protect others from you. It stops respiratory droplets. For example, if you're sneezing or coughing, it stops the droplets from spreading. So if you are sick and you have the virus or you're coughing and you're sneezing, you should wear this mask. The N95, it helps reduce exposure to bacteria and viruses, but again, it's not 100%. The other problem is because there is a shortage in masks in many countries that prefer to give these masks to healthcare workers, doctors, nurses, those who are exposed to the virus, than to give it to the public. Here in Vietnam, they recommend masks to everyone, so you need to wear them. Is there any scientific evidence that COVID-19 can exist and spread by airborne transmission? Yes, but you need to be in very close contact to the person to become infected. So keeping away for at least 2 meters should be okay. The big problem are the droplets that fall on surfaces, and they can last for hours and even days after the infected person already left. That's a major problem with the virus. Does hot weather and sunshine help? Unfortunately, no.
Hi, Jonathan. The connection is kind of patchy, so I know I dropped off for a bit. Actually, that last question was mine, whether sunshine and hot weather help. Because some people are saying that, maybe summertime is coming. Maybe, Singapore and New City have a lot of sunshine. Maybe that's often the cases. So I just thought I'll ask you the question.
Yeah, we can only hope and pray, but at the moment there's no evidence that this virus will go away in the summer. We all hope for that, but what we know from other coronaviruses, usually most of the cases happen during the winter time, but we can also see coronaviruses, I'm talking about the regular common cold coronaviruses. It can happen also in the summer as well.
Okay. In terms of like the medication side of things, I know that a lot of drug companies scrambling and moving forward to vaccine. So, how long would that normally take? I mean, I understand they can take a year or more than 1 year, but at the same time, these are exceptional circumstances today. Today we have technology like AI. So I think we're just wondering, when it comes to developing a vaccine, going through clinical trials, can it be somehow accelerated, or is it going to take that same 1 year or maybe 1.5 year period?
The problem with developing vaccines is, first, you need to make sure that it actually works. So you need to have a proper study, to make sure that the vaccine works. The second problem is you have to make sure that the vaccine is safe. If you have a vaccine that might protect you from the virus but can cause significant side effects, then you might cause more damage than good. And these procedures, it takes time to develop the vaccine, to test the vaccine, to make sure that it's effective and safe. It takes months. And unfortunately, this is, if I can say a few personal words, I think this virus just shows how we as human beings have failed to be prepared. Over the last 20 years, we had the SARS, we had the MERS, we had the avian flu, the swine flu, the Zika. It's like the nature was telling us again and again and again that it's coming. And everybody knew in the scientific world, in the medical world, everybody knew that it's just a matter of time till we have such an epidemic. And actually, this virus is not as bad as it could have been. It could have been much, much worse. And unfortunately, we are not prepared. We invest more money in developing cell phones than in developing vaccines or proper medical care. You get a new phone every 3-4 months, but the vaccines that we use, some of them are 70 years old. if you take the BCG vaccine, for example, for TB, this technology is 70 years old. It was invented in the 50s. And we still use the same technology to protect ourselves from TB, which so far killed more people than the coronavirus. We have an influenza vaccine, again, decades technology, and unfortunately, it's not a very effective vaccine. We always have to guess which influenza viruses are going to happen next year, and we try to adjust the vaccines to that. We have vaccines for pertussis and MMR, and again, with technologies that are already decades old. So this is the big problem. We invest more in technology, in cell phones, in tablets, and less in our health. So I think we should use this pandemic as a wake-up call.
Yeah, and I think this pandemic really puts to task the healthcare systems, the level of preparedness, and indeed, I think does show the weaknesses that I think folks on hindsight wish they should have addressed. I do agree with you that this is not the first outbreak. I mean, this is the first pandemic I think in a long while. But there are all other kinds of warning signs that medical science and nature was. Actually, you raised the point around our smart devices and tablets. I do have one interesting question too, from my IT guy actually, which is how do you disinfect? So on one hand, I think we've gotten a lot of advice around wash your hands with soap and water, use 60% alcohol, hand sanitizers. But what about this? Because I think you pointed out earlier that you're known to linger around. What is it? 7 days, 17 days, or something. Then I read somewhere that depending on the type of surface, whether it's fabrics like your clothes, whether it's devices and glass, whether it's the wood of your table, I think they all might keep the virus there for different periods of time. So maybe some advice around disinfecting, whether it's your device or the clothes. I suppose you just wash it. But yeah, I'm happy to hear some of your thoughts there.
Yeah, if you're quarantined, for example, you need to put your clothes in a closed bag and wash them separately. To use, there are different kinds of disinfectants you can use on surfaces with alcohol or even diluted bleach. You can use diluted bleach to wash certain surfaces. One thing that is very important to say, we all wash our hands with alcohol solutions. We need to remember that alcohol is flammable. So if you're a smoker or if you're cooking, you need to be careful. You need to make sure that your hands are completely dry before you light your cigarette or before you cook. There were cases of people who got burned because of the alcohol solutions. So be very careful.
That is a good reminder. In fact, I think that's something I put out on Facebook as well. Just remind folks that it's flammable, so don't light candles and hand sanitize at the same time. Okay. So back in the area of drugs and medication, I think from what I read, I think different countries are experimenting with different antiviral methods. Talk about using anti-malarial drug to test it out in this situation. I think in all fairness to the medical community, we're in a big area of unknown. I gather that different folks are trying different things. But maybe we can have a bit of read from you about what are some of the treatments they're using. I know there's no vaccine, but what kind of treatments are they using? Is it something as straightforward as say, okay, a paracetamol to bring down the fever? Or is it something a bit more specialized? The drugs that have been used for, I don't know, Ebola, HIV, or something that was used to treat the
Well, before I talk about the treatment, I want to just simply explain about what exactly the virus is doing to our respiratory cells. So the virus enters the lung cell through a receptor called ACE2. When the virus enters the cell, the genetic material, the RNA, is expressed, and two things happen. One, there is an enzyme that starts replicating new genetic material, new RNA material. And the second thing that happens is the cell starts producing proteins that the RNA is encoding. So it takes the RNA, it's like a code, it reads the RNA, and it starts producing proteins. Now it starts producing large molecules of protein, and then there is another enzyme that breaks down these proteins into different components. And eventually what happens is there is assembly of these proteins and the new RNA material to create new viruses. And these viruses spread out and reinfect other cells. The antiviral medications that are being used right now, some of them target these enzymes. One of them targets the enzyme that replicates the RNA. Another one targets the enzyme that builds up the proteins. Another medication is targeting the enzyme that breaks down the protein molecules into smaller molecules. There's a medication called remdesivir, which was used in Ebola, and this one targets the RNA duplication. The chloroquine, the antimalarial medication, is believed to work on the entrance of the virus into the cell. It's supposed to reduce the entrance of the virus into the cell. There's not a lot of evidence that it actually works, but in this condition, we're actually quite desperate. So doctors just try everything, proven or unproven, they try everything. But there are several problems with these medications. Chloroquine, for example, it can cause hemolytic anemia. That means people with what we call G6PD deficiency, it's a condition that is quite common in Asians. If they are exposed to this medication, it breaks down their red blood cells and it can cause severe anemia. There's another medication called hydroxychloroquine, which is okay for G6PD deficiency, but it can have side effects on the heart. The other medications, the antiviral medications, they're basically safe, but some of them may have side effects, again, on the heart, on the kidneys, on the liver. And if a person is already in a condition where his body function is altered, that can add up to the problem. So far, again, there's no strong evidence that these medications work, but small studies show some improvement. And again, when you're desperate, you're going to throw everything in.
Yeah, I think right now it's very and hopeful that technology can make a difference. Speaking of technology, I think what I read was there's a need for ventilators. I think particular in Italy, and actually is very in these unfortunate circumstances. At least it is encouraging and heartwarming to see so engineers going into frugal innovation. So I think they 3D printed ventilators. I think I read somewhere they had that. They also had a that decathlon snorkeling mask. Yeah, and then they also 3D printed a component of and make it into a ventilator. So I think it also creates this kind of abilities. What's that phrase? Something about the mother of invention is aspiration or something. But another sort of question around that is drug testing. Because in some countries it seems that, for example, South Korea. They did they tested a whole lot of folks. They did tests they could roll out. I think in Singapore, they test if they think that you might be infected. It seems that some countries are struggling to even get tests. I'm just trying to get a read of, isn't there are there test kits easily available? Is there a shortage of test kits? Are we still developing test kits?
Yes. First of all, yes, there is a shortage. Second is these tests. When we do the test, we take a swab from the nose and from the throat, and we need to put it in a special kind of solution and take it to the laboratory and run the test. These tests, we don't know exactly how sensitive and how accurate they are. It can be anywhere between 60 to 80%. It also very much depends on how you collect the sample. So if the person who was collecting the sample was not vigorous enough, the sample might be falsely negative. So there are a lot of technical issues with these samples, and again, at the moment there are not enough kits to go around. That's why hospitals save it for certain conditions. In conditions where you need to prove that there is a coronavirus because you need to quarantine a huge group of people, or if there was a wide exposure, like for example in the Buddha Bar in District 2. So in these cases, it's very important to detect the infected people and to quarantine them. But many times, when there are suspicions, the government just quarantines people without even testing them. So if I'm not mistaken, at the moment in Churai district, where they quarantine people, I think there are more than 20,000 people under quarantine. That's the numbers I heard of so far. Most of them haven't been tested.
Yeah, these are difficult and challenging times, and therefore these are tough measures. I know there are a lot of debate about is it too much or too little, but I think certainly it's a time when people are exercising an abundance of caution for all very good reasons. And in particular, back to I think a key point, at least to me, was that you're trying to flatten that curve. We don't want 1,000 people rushing for one exit door. You can't, once you have that, then it's going to really cripple the healthcare system, and then folks would be in jeopardy, not from the disease itself, but from other things. We are coming up against the hour. So right now it just leaves me to thank Dr. Jonathan for the time, for all your precious insights. I'm wishing everyone to stay safe, stay home, stay healthy, have some quality time with your kids. Maybe that's a good time to do it. Catch up on some of the reading. And for those of us that are working at home, we're just going to try and carry on business as usual as much as we can, but remotely. Jonathan, any final words from you?
Yeah, I think for me, this is a good time to start learning how to play the piano. It's something I always wanted to do.
Okay.
Okay. Thank you very much for inviting me.
All right. Thank you. Bye, guys.
Healthy day.
Definitely.